Hi, everyone. I'm Jason Chapin, Director of Workforce Development at the Westchester County Association. Welcome to our career chat with New York Presbyterian Hospital. Before we get started, I want to thank our platinum sponsors for supporting WCA and this event. And before I introduce our guests, I'd also like to thank our healthcare heroes for everything they've done during the pandemic. And thank you to WCA members. We have many college members who are a big part of today's event, and they include Berkeley College, the College of Westchester, Fordham University, Iona College, Manhattan College, Manhattanville College, Mercy College, Monroe College, Pace University, Purchase College, St. Thomas Aquinas College, Westchester Community College, as well as Dominican College, Southern Westchester, Putnam Northern Westchester, and Rockland Both East, and Westchester County's Workforce Board and Career Centers for partnering with us. Now, let's begin. It's my great pleasure to introduce Rosemary Sullivan, Director of Talent Acquisition, and Elyse Zlotnikov, Talent Acquisition Recruiter at New York-Presbyterian Hospital. Welcome.
Thank you, Jason, and thank you for inviting us to participate today.
Thank you for having us.
And thank you very much for joining us. I have a few questions for you, and we'll cover a lot of topics. And then I want to open it up to our job seekers who are joining us today. And I think we're going to have a great discussion. So I'd like to start with Rosemary, and I'd like to find out if you could share with us a little bit about you and you working for New York Presbyterian.
Okay, so that's a great question to start. So I am a nurse, and I came to New York Presbyterian 20 years ago in a very different position than what I am in now. And I was on the 5-year plan. I never planned to stay, but when I got here, I realized all the opportunity this hospital had, how patient-centric it was. I've worked in 3 other hospital systems, and no system really values the patients as much as New York Presbyterian does. But the other really impressive thing was, for me anyway, how much the employees are valued. I have been given unbelievable opportunities. I've been to Paris. I've taken care of very famous people, so many different things. And in times of crisis like COVID, the hospital has stepped up like you can't believe, looking at every aspect of what a staff member might need. So that's me. That's why I stayed. And that's why I invite you to consider whether or not this is a good fit for you. So thank you.
Okay, great. And Elyse, if you could tell us how you ended up at New York Presbyterian and tell us a little bit about New York Presbyterian.
Sure. So I had been working in healthcare in human resources, and an opportunity became available. And I thought, okay, well, I will try, we'll see 3, maybe 5 years. And then 10 years passed, and it was really like in the blink of an eye. And I have enjoyed every bit of the time that I have spent at New York Presbyterian. It's an opportunities that are afforded to employees, whether you're staying in your same role and you're able to grow within that role over time, or able to move into new opportunities within different parts of the hospital, and being able to welcome people into the organization through a position in talent acquisition, and really being able to take pride in who's hired for our organization, because the New York Presbyterian values their employees tremendously. I mean, we talk about putting patients first, but in order to be able to put patients first, we need to make sure that our employees are taken care of and feel supported through that. And that has been what has turned into, maybe 2 years, 3 years, into 10 in the blink of an eye.
Okay, so it sounds like there's 30 years of incredible experience between the two of you at New York Presbyterian, so you'll be able to answer any and all questions.
Oh, wait, let's not get carried away.
Okay, we'll
The
take
best.
one question at a time. All right, and for our viewers, we have the opportunity to take your questions, and you can type them in at the bottom of the screen, and we'll get to them after just a few minutes of some other questions we've already prepared. So I'd also like to ask both of you, starting with Rosemary, to tell us about New York Presbyterian, the hospital and the locations, what you would like others to know about New York Presbyterian.
So when people think of New York Presbyterian, they generally think of Columbia, which is on in northern Manhattan on West 168th Street, and Cornell on East 68th Street. Those are the two academic medical centers for Columbia and Cornell. But we also have opportunities close at hand for those of you living in Westchester at Lawrence Hospital in Bronxville and Hudson Valley Hospital in Cortlandt Manor. We also have hospitals in Lower Manhattan in the financial district. We have a hospital in Brooklyn Methodist, a hospital in Queens. Elyse, did I leave out any?
No, I don't think so. So, the hospitals that are on the Upper West Side and Upper Manhattan is our Columbia campuses, and we also have Choney, the Children's Hospital, as well as the Allen Pavilion, all within a few blocks of each other.
Get them. So the bottom line is most people, when they apply to us, the first question we ask them is, where do they live? And what's the easiest commute? And we go from there. So we actually have two hospitals on the Upper East, a psychiatric hospital on the Upper East Side and one in White Plains. So we ask people, where do they live? What do they want to do? And then try to work with them to find the positions that they apply to that are doable. Because we recognize nobody wants a 2-hour commute, especially now with the way public transportation is. So in short, we have 11 campuses, 1,300 open available positions that we are recruiting for. So there is something for everyone.
Yes, okay. So there are hospitals, behavioral health hospitals, and lots of different locations and lots of positions. So let's talk about some of the positions. I'd like to start with Elyse. If you could tell us about the different types of positions that you're trying to fill, and then I'd like to talk about some of the specific positions that you want to make sure that our viewers are aware of and have the opportunity to apply for.
Sure. So we have positions available in all areas. One thing about hospitals is they're like mini cities. We have so many different departments that make up the entire gamut of the hospital. So some of the positions that we are really on our hot list right now are laboratory technologists. As you know, you hear every day in the news, testing, and we are doing a lot of testing, not only of our patients, but also for our employees. So more laboratory technologists in all of our campuses, and respiratory therapists, which is really those two positions. I know you talk about frontline workers. I think those are the two positions you don't really hear as much about, even though they are vital to what's happening right now. In addition to that, nurses who have experience that can work in the ORs. We're opening up the operating rooms again, that can work in the ICUs, med-surg, and you name it, any nurses, experienced nurses, and we do take a large number of new graduates as well into many different areas. And then also some of the positions you may not think as much about when you're thinking about a hospital, but environmental services and food services and facilities. We have positions in our corporate structure as well. And so there definitely are a number of positions that aren't just your frontline workers. I know sometimes people are hesitant to apply to a hospital because they may think, oh, well, I'm not clinical. But there are a number of non-clinical positions. And one of the things that we've done for this event is we have specific postings that we've put up on our website. So we will see who has been able to apply to positions where we want to give priority to the people that are tuning in today. And those positions will say WCA, and we have nursing, allied health, and non-clinical professionals, as well as one for laboratory and one for respiratory.
That's great. It's really critical that we're able to share the specific positions. And I'd like to ask Rosemary about the types of positions. We talked about the different areas, but are there per diem and part-time and full-time positions at the different locations?
So there are. To work per diem means you come in when you can. So we do not hire newly graduated individuals in any of our per diem positions. We want you to have experience, so when you come in, you could hit the ground running. We provide an orientation, but that is not nearly enough. For RNs, respiratory therapists, we do not, laboratory technologists, we do not hire you on a part-time basis because you really need the consistency of being there every day so that you learn your job and learn your trade. But people with experience in these areas who maybe are going to school for an advanced degree or just can't work part-time for a lifestyle reason, we do hire part-time and per diem. Our part-timers and our per diem, our part-timers and full-times do get benefits, health care benefits, paid holiday, sick and vacation time, whereas per diems, you don't get anything. And that may not be important to you if you have another job, but if you need those benefits, a tremendous benefit in addition to our tuition reimbursement. So specifically, what are we looking for right now? The hot jobs Elyse described. But one thing that people don't think of is these are not only jobs that require degrees. We have a tremendous need for the individuals who maintain our structures, like our boilers. I did not realize that we value and need people who worked in the Navy on those ships, because our boilers are the exact same boiler that's on a Navy ship. So if you have that kind of experience, we need you. If you have HVAC experience, we need you. Electricians, plumbers, all of those areas are equally as important to our frontline staff. Just think about it. This is like a hotel for sick people. Who wants to be with no air conditioning in a day when it's 100-some degrees, or not be able to get hot water? It's all these things that make us work. We have an enormous IT department. We're now upgrading to the Epic system. It requires a village, literally, to train everybody, to get everybody up, and to keep the system going. So lots of different jobs, lots of different skills. It's just a matter of, like Elyse said, identifying what you are interested in and what you qualify for, and then going from there.
Well, I think that's an interesting analogy. Ships and hospitals. I know that a lot of ships are floating cities, and it now sounds like hospitals are like cities too. They have a little of everything.
They are. And actually, sometimes I think about it as my best reference or analogy is we are literally a hotel for sick people. Think about it that way. Anything you have in a hotel, we have to have in a hospital. Unfortunately, not gourmet food yet, but maybe we'll get there.
Okay, and just a reminder, viewers, we've been posting emails for Rosemary and Elyse, and also the link to the jobs. And this is being recorded and will be available on demand if you missed any of the information that we posted. So I want to start with Elyse and then go back to Rosemary and talk about the benefits that you offer, as well as some of the career advancement opportunities at New York Presbyterian.
Sure. So the benefits are excellent. All the part-time and the full-time positions, whether you are getting your benefits straight from the hospital or through the union, all come with benefits. Tuition reimbursement is something that many of our employees take advantage of. our total rewards department has done a tremendous job at meeting the needs of the employees during this pandemic. They increased childcare benefit for employees. There was something that was always offered. One of the things that I thought was amazing was they really take care of the entire family. One of the benefits that they have for not only just childcare, but elder care and adult care. So the employee can focus on getting their work done and know that their family is taken care of. There's emergency drop-off care, which is just wonderful, wonderful thing, especially now when our children are in school, but yet you still have to go to work. Or, they're not going to school every day, but you still have to go to work. So it's a great benefit to know. And again, it's something they think about the whole family. Another benefit that includes the whole family is some of the mental health options that have been available to the families even prior to this, where if the employee or somebody in their family is struggling, they can call this hotline and get the services that they need. So the benefits, just as I said, are really wonderful. They're really thinking about the employee and putting the employee first.
Yes, it's very clear. You're investing in people and your talent, and they mean everything to you. And you want to make sure that you're providing what they need in order to do their job. So that's important to know. And Rosemary, if you could also tell us any of the benefits we missed or some of the career advancement opportunities that you want to make sure everyone's aware of.
Okay, so parallel to the health benefits, the pensions, the paid time off, we also have an investment in development. We have an entire department whose sole purpose is working on the development of individuals. For individuals who want to learn a new skill, like we have people who actually come who don't know how to use Microsoft Office. And that is a requirement for almost every job, especially Excel. So we have classes for that. We have classes for people who are present or aspiring leaders. For our present leaders, it's how to be a better leader or a more effective leader. For new people, it's really how to work with your staff, how to be kind and empathetic and all those things. And in between, there's innumerable opportunities we have. Dialogues in diversity, where we can learn about understanding different groups and a bunch of things like that. They're all online. We have access to online learning where we can, if we want to learn about something, we can get it. It's for free. We also have tuition reimbursement on all of our positions. So that if you are in a role and you need tuition or you desires to go back to school, you can go back. We also have the opportunity we have 4 contracts with online schools that you can get a bachelor's, a master's, a PhD, and it's totally free. The hospital picks up the credits. We have a lab scholars program with Marist College and numerous other things. And then within the jobs, we have what we call career ladders. So you have to accomplish certain goals, do certain things, and apply for it. But it's not like we have a limited number of positions. It's unlimited. It's just a matter of your making up your mind. You want to advance yourself. So and we have career coaching. So you can make appointments with people in the talent department to figure out what you need to do to get yourself moving forward. Sometimes a lot of people don't know, and we can get to know you, find out what you need. We run seminars on how to ace the interview. You know how, for some people who have been out of the workforce for a really long time, it is really pretty scary to have thought of an interview. And people tell me all the time how frightening it is. And now it's by telephone or WebEx, virtual. That's a whole other thing. So we work on that with individuals. And we provide another program called Acing the Interview, where we really prepare you To do that, we have managing your career to set short and long-term goals so that we prepare you. If you desire to get ahead, you can get ahead. And so there's innumerable opportunities. It's just a matter of figuring out what you want to do and taking that very first step that's so scary.
Yeah, and having 11 campuses really allows employees to stay within the organization, which is great for New York Presbyterian because we don't lose good talent. There are many times where somebody wants to grow, but a position or an opportunity is not available. And through the career guidance appointments that that employees can set up with talent acquisition, we're able to open the doors, maybe not putting them into a new position right away, but letting them know what they need to do or putting them in touch with somebody who they can then ask the right questions where they may not have been able to do that prior. Another awesome thing that has been great, I think, or very rewarding in our department is watching people come in one role and completely grow their career at New York Presbyterian. And again, because we have 11 campuses, it allows you to do that. And so for people that are hesitant to apply to positions because they feel that it may not be the right job or the right department, I would say still apply because we do have 11 campuses and the talent acquisition recruiters work really closely together to share candidates and to make sure that we're bringing in great talent. And if it's something in terms of a learning curve, there are so many skills and tools that we have to develop employees. So I would say absolutely apply to positions and don't hesitate to do it, especially now where people really need to work.
And the other thing, if coming to Manhattan and these giant hospitals is overwhelming to you, consider working at one of the smaller hospitals, either in Westchester, the Bronx, the other campuses, they're community hospitals, smaller numbers of beds, not all this. They do a lot of amazing things, really, truly amazing, but it's a little more friendly. But even at the big campuses, you always feel like you're part of something bigger than yourself. And people do get to know your name and say hello to you and all of that. So it's not like you're lost in the crowd.
So over the years, you've hired a lot of people. And I'd like to ask you, Rosemary, if you have a favorite story about someone you hired and what happened to them over the years working at New York Presbyterian.
So I was reflecting in the height of this COVID crisis and looking at the leaders, the frontline managers across the enterprise. And I think what I was most proud of, and I am most proud of, is the numbers of individuals who started here right out of school, and now there are these amazing, amazing leaders. And I never forget them, and they never forget me. If I'm walking down a hallway or going to another campus, people are, come up to me. Some people, before social distancing, actually would give me a hug. And they reach out and email me every now and again, either for advice or to tell me they did this amazing, have achieved such amazing results. And that was really obvious on the day we had our magnet designations at both Columbia and Weill Cornell to see how many of these people that probably Elyse hired, I hired, but started here out of school, and now they're like doing just so well and loving every minute of it.
All right. I know we've got a bunch of questions. I just have one or two more, and then we're going to get to our viewer questions. But I saw Elyse smiling, and I want to ask if you have a favorite story of somebody you hired and what happened after.
Well, I definitely can agree with Rosemary in terms of hiring somebody in one position and watching them grow throughout their career and becoming leaders in the organization, which is definitely, I think, really rewarding for all of us. One story that stands out for me in particular, and I've actually carried it with me throughout my entire time at New York Presbyterian. When I first started, I hired somebody into a nursing position, and it escapes me what unit she started on. And she called me during the holidays to thank me for the opportunity and asked me if I knew that she was homeless, which I didn't know. I mean, we don't ask about, people's personal lives and where they go every day. But she was homeless. She was living out of her car. And it always strikes me when I think to myself, I'm really tired at the end of the day, but I have 2 more offers to get out. But those offers change people's lives. And that always stays with me every time if I'm having a day that can be a really tough day where there's a lot going on, it's always thinking about the employee and the opportunities that they're going to be able to be afforded. That has really hit me from the beginning. I think that one employee has had a really lasting effect on me, which has been great because I've carried it through my entire career and time at New York Presbyterian.
Yeah, it's interesting that you mentioned that because a lot of times when somebody gets a job, it's a great thing for them, but it's also a great thing for their family. It affects many other people. And I also want to just ask you, starting with Elyse, if you could tell us, you get a lot of applications, you interview a lot of people. What are the qualifications, the characteristics you're looking for? What makes for a good candidate?
We really look for people to be themselves. So I would say when you're interviewing, be yourself, be professional and definitely bring your best self to the interview, but be yourself and let your personality shine through because you are going to be working in teams. We're a very team-oriented organization. And allowing us to see what your personality is like will allow us also to know what team would be best for you. We do ask behavioral-based questions. So we're going to ask you to come up with a list of questions. This is something that we also review in our Acing the Interview and Managing Your Career seminars, as we talk about coming up with a list of questions that you could be asked. Write down your experiences and what you did in those experiences. We really want to know if something happened, what did you do during that experience? And that allows us to really learn about the applicant and learn where they're going to be a best fit within the organization.
All right.
So
and go ahead, Rosemary.
So I like to see a candidate, I think Elyse would agree with this, that's passionate. That really, when you ask the question, why do you want to come to New York Presbyterian? You don't want to hear, well, we heard you pay well, or there's good benefits here. We want to hear something along the lines, we want to help people, we want to be part of a solution, things like that. When we ask you for examples about times when you went above and beyond, that you give a significant example. And I've heard amazing examples. There have been a few times when I actually cried, but we don't expect tears, but we do expect you to be passionate and really want to come here for the right reasons, which is to provide quality care, to be part of a team. And if you're not providing care, you're supporting care. You're working in the finance department, which means you work to make sure that there's adequate resource for individuals to do their jobs and things like that. So I think the passion and the empathy is what I look for in a candidate. It's sincerity. We love veterans. We love people who have volunteered and who this is not their first career. We love all of that. That richness makes us a better organization and contributes so much to the experience.
Yeah, and I would also, with adding to Rosemary, where people do, sometimes they'll go into a new career and they'll leave off their prior career. Even if you put it in bullet points, we like to see it. We maybe are one of the only organizations that I know of that does like to see it. A lot of times you'll hear, oh, that's what you did in the past, take it off your resume. But we actually want to know who you are, and positions that you've held are your stepping stones to getting you to where you are today.
Like some people will say, well, I had this job in the summer waiting tables. Great. You have great customer service skills. You are a bartender. You kept people safe. You dealt with people. You resolved conflict. All of those things are important. You worked in retail. you know everything about customer service, and you know about accountability for that register. It's not that very different from being accountable for other things. If you work in the the frontline staff, you're accounting for narcotics, you're accounting for supplies. If you're working in finance, you're accounting for pennies. So we look for that. That makes you a better candidate. Somebody who's never worked, never volunteered, I'm always skeptical because I'm wondering how they're going to adapt to this environment.
I want to get in one more question before we open it up to our viewers because we have a lot of questions to get to. So I want to ask you, Rosemary, if you could let me know, let us know if there's anything we haven't covered yet that you want to make sure our viewers, job seekers, know about.
The only thing I can say is just piggybacking on what Elyse said, please take the interview seriously. Make sure that you set a time when you are available, that when you get the call from the recruiter, or if we ever go back to face-to-face interviewing, you are on time, that you are professional. And because in the first 60 seconds or so, that whole package of you sets the tone for the entire interview. So when you're 30 minutes late and you expect to be seen, or you come in some crazy outfit, it sort of says a message about respect. So we want you to take the interactions very seriously, and that includes the kinds of emails you send to us. Excuse me. We're adults. We work hard, and we don't need, it's just not proper to send an email that's aggressive, to get everybody and its mother involved in communicating with us because you feel like we haven't gotten back to you timely. We try to give you a timely response, but sometimes we have over 200 people applying to the same job. We have to give them all the same respect as we gave you. So be patient, think before you fire off that email. That's one of my best pieces of advice, because that is a deal breaker for sure. When you send those nasty mails, it's a problem.
All right. Did we miss anything, Elyse, before we get to questions?
The only thing that I want to just say as a reminder is to, when you go to our website, and I know it will be listed, and the positions that we've posted specifically for the viewers to apply to. If you see other positions that you're interested in, definitely apply to those other positions. Don't apply to a ton of positions, but be strategic about what you're applying to. It allows us to see where you're most interested, and it also allows us to be able to forward your application to the right recruiters and to the right departments. So definitely be strategic as to look at your top 3 to 5 positions that you'd be interested in. Certainly apply to the posting that we have up, because that allows us to know that you've attended this event, and we really are looking to give priority to the candidates that are coming from these schools. And we know it's already difficult graduating from school and looking for a job, and now even more so than ever.
Yeah, I know we have some viewers who are either college students who just graduated or about to graduate, as well as some alums, as well as parents of some of the students and other job seekers. So a lot of people out there. So let's get to their questions. And I'll go back and forth and ask each of you different questions so we can get through as many as possible. The first question: I'm a recent Monroe College graduate with a degree in hospitality management. What job opportunities are there for me to apply to? Let's start with Elyse.
Sure. So some of the positions that come to mind immediately are positions in our patient experience department. We have an entire department that is dedicated to patient experience. They work across all of our campuses. They've been instrumental during COVID. One of the things to definitely mention also is if you are especially with hospitality management, which obviously comes with good customer service. So any position that you see there, our positions lately have been doing a lot of cross-training to be able to work in other areas. It's something that was really evident during the height of the pandemic. So I would say patient experience, customer service, registrar, anything that's going to put you in front of the patient and in front of the patient's families to really, it sounds like if that's what you went to school for, that's probably where you shine. So those would be the positions I would say to start applying to.
All right, next question.
Okay, Jason, I'm going to read the next one to you. Do you have any entry-level human resources or internships available right now or in the future, and how can I apply for it?
And Rosemary, you want to answer that one?
Sure. So right now, this summer, we do not have any internships because the organization wants to limit the number of people that are coming in the building. So in human resources, we do have human resources assistants and in that department, and a lot of people start off there, or a position called a human resources generalist. In our department, talent acquisition, you might start off as a specialist, which is the individual who supports the recruiter in trying to find candidates for difficult to fill positions. So yes, there are positions, and you can, every position that's posted online, there is a description and the requirements, and so you have to have both, but we do take plenty of new graduates into the human resources department.
All right, I feel like we started the lightning round, so we're going to see if we can get through a lot of other questions. And let's go to Elyse. I hold an RN license and finish with my BSN in July. Can I apply now?
So you already hold the RN license, which is great. Absolutely. I would say start applying now. Between the interview process and the onboarding process, it might take a couple of weeks. July is right around the corner. So even if we're looking at a start date, and I won't get into the specifics now about getting our new hires cleared, but there are ways that we'll know and be able to confirm that somebody is graduating. They won't be able to start until after they hold that BSN, but we can certainly start the process because it sounds like they're already an experienced RN.
I've got two pros. They're fast on their feet. Okay, Rosemary, next question. Are there any positions in biostatistician, junior level?
Oh boy. So we do have a huge resource department, but many of the individuals who have that skill set, we do refer them to Columbia University or Cornell University. We work very closely with them. They are really the research arms of the hospital. All of our doctors work in those positions, and they're needed there. We don't have that many in the house exactly employed by the hospital, but working for the university is a very good option and lots of opportunities to grow within the research department.
All right, next question. And we'll start with Elyse. Are you hiring unlicensed new graduate nurses as seen in a job posting?
No, you would need to be on the road to taking your NCLEX. We require an RN license for someone to start.
Would there be the possibility if somebody had the credentials for a lower position, could they start at the lower position, and then when they pass their NCLEX, could they then interview for the RN position?
We put so much into training and so much goes into hiring somebody into the right position. It wouldn't make sense to have somebody who's about to take their NCLEX start in another position because it's a lot of orientation that goes into getting somebody into a position. And also what would happen then is the actual position that they're going into, not the RN position, but the other position, that then still becomes a vacant position that leaves a department in need of an employee there as well. So it's not something that we do. We do need you to have your RN license. And if you're close to taking the NCLEX, it makes sense to apply to the positions that are specific to what you're really looking to do.
Okay, thanks for clarifying. Rosemary, want to add anything?
Yes, we do currently have a job posting on the careers website for unlicensed RNs. And we did this with the intent that as people begin to get licenses, they will notify us and we will, give them priority and hire. So we cannot hire you without a license, and currently we're not giving permits. So 30% of our workforce are new graduates.
Okay, great. Next question, and we'll start with Rosemary. Hello, are there PCA positions available?
Lots and lots of them. We don't require a license. That's only in a nursing home. We require training, and we prefer people who have some experience in a hospital. So we have PCAs, and we also have PPCAs, which are PCAs who work in the operating room, who have sort of a multi-skilled job. They help the patients get on and off the operating room table. They assist in the transport of the patient from surgery to the recovery room, but they also clean the room between cases. So that is a job that we definitely have positions for all campuses.
And you may find that they're called different things at so they may be under a different title at a different campus. Also, if you see the title of an ICU tech or an emergency room tech, they all fall in similar line with the experience that's needed. So I would say look at different positions at the different titles and look at the requirements to see if it's in line with what you're looking for, just because they may be listed under a different title than just PCA.
Okay, and Elyse, are you recruiting for social work graduates?
So typically we had interns that were social workers and social work students, and we do hire new graduate social workers. We hire new graduate social workers into all of our campuses.
All right. Anything you want to add, Rosemary?
No, the only place we don't hire new social workers would be in the clinic. And for all the social work positions, being bilingual, either English, Spanish, or for two of our campuses, English, Chinese, either Mandarin or Cantonese, is very much valued. So yes, we do hire them.
And I'm glad you mentioned languages, because I know that you're always looking for people with bilingual skills, and that's something that anybody who has that skill should highlight or mention in their application. Okay, great.
Absolutely.
And the next question, we'll go to Rosemary. I was wondering, what is the difference between a nursing residency position opposed to a regular staff RN position? Which is best recommended for new grads?
So there's a lot of debate about this. What is recommended by the research and supported is a program of support for the new graduate, a residency. And we do have one at New-York-Presbyterian. It's an entire year. It's one of only 35 programs in the country that are actually certified. The other kind of residency is clinical residency, a combination of classroom and clinical. We did have them here, but we found that they weren't successful. The individuals did not want to be back in the classroom, in many cases did not need to be, and they really valued or needed the clinical experience first. All hospitals, like Elyse said, have some sort of an orientation. So it's great when you can find a hospital that has residency, but if you can't, you've got to make the best of what it is. But by regulation, the hospital has got to have an orientation that prepares you to do the job and measures your clinical competency and assures that you learn what you don't know. So it is important, but it should not be a deal breaker, because sometimes you're in a situation where the hospital otherwise is great. If they don't have a residency, it would be very foolish to walk away from that opportunity.
All right, the questions keep coming in. And the next question is, and we'll start with Elyse. What is the expected time frame to hear back regarding a position that someone applied to? And if you could also just talk about, I know there's really a lot of urgency in filling positions, and if you're hiring timeline, if a lot of these jobs are immediate hires, meaning that you're hiring faster than maybe you did months ago.
Sure. So there are certain positions where probably daily we are checking the postings. When we do post a position, typically we'll give it a couple of days for the candidates to apply. So I would say expect to hear back when you apply to a position. Give it a week to 2 weeks before you hear anything. You may hear sooner depending on the position. And it's the same thing when you interview. If you interview for a position, I know we all know how hard it is to be on the other end when you are the applicant and wanting to hear back about a specific position that you interviewed for, that you applied to, but also understand that sometimes it takes a couple of weeks for us to be able to get back to somebody before a final decision is made in terms of the interview, but also for the application. It really depends on the position. As I said, like if it's a position where it's a laboratory technologist or respiratory therapist that we need immediately, we are probably checking those positions every single day, and you can expect to hear back within 24 to 48 hours of applying. If it is another position, you're probably 1 to 2 weeks before you would hear back, but you should get some notification from your application. And most of our notifications are all through email. So also make sure that you have New York-Presbyterian listed as an email that you can receive and isn't on your spam or your blocked list.
Okay, and we've got another question. I think this is a first-time question. So we have a lot of people watching this event, and they want to know if they should reference that they were watching this event when they communicate with you and apply for a position.
Absolutely. That's why we created those requisite job postings online. We are committed to giving you preference.
Okay, good question and good answer. Okay, next question. And we'll start with Elyse. Do you have any entry-level human resource or internship positions available right now or in the future, and how can we apply for it? I know we talked briefly about the internship situation, but if there's any other information you can offer, Elyse, about other positions.
Sure. So right now with internships and volunteer positions, those have been on hold for the current time. I don't know exactly when those will be reinstated, but right now we do have those on hold. Entry-level positions you can find on our website. If you go and look under non-clinical professional, you'll see any of those positions. You can also type in keyword search, so you can put in human resources, and those positions will come up as well. I'm not familiar with any entry-level positions for human resources right now. It doesn't mean that it's not on the website. I haven't seen it in the last 2 days, but there may be there today. So I would certainly urge somebody to apply. You also can, if human resources is the avenue you're looking to go down to, you can apply, you can sign up to get email reminders or like a message sent to you when a position does become available with what you're looking for.
Great. So we have 3 more questions. Just want to remind our viewers, if we don't get to all of the questions, or if you have some questions after you watch this, you can post those on the Facebook page or the LinkedIn page, and we'll try and get an answer for you. So Rosemary, the next, any positions for public health?
So we don't have a home care department as such. We do have, we have a huge clinic population where we have many jobs. And right now, with this COVID pandemic, we are doing just what every other hospital is doing and what the CDC recommends, and that is really tracking, looking at populations and all of that. And those positions are positions that truly are public health. But, excuse me, if you're interested in working with in a more of community setting, our outpatient department is a fabulous way of learning that. And there's many positions in that department, from very entry-level positions as registrars, patient financial advisors. We have medical assistants, we have RNs, we have clerks. We have many nurse practitioners and physician's assistants, and surprisingly, a lot of our staff start there and just progress all the way up. So, in fact, our director of one of our ambulatory care settings started in the hospital as a security guard, oddly enough, and is now in charge of all of these community projects. So that is, we do have those kinds of positions. Elyse gave you a great piece of advice, which is to set up a profile through the careers website, sign up for the job alerts, and as the positions become available, you will get notified and you can apply. Believe it or not, sometimes for these positions, we have very few applicants. And we're looking for people, and so it's an ideal opportunity. Great question. Thank you.
All right, let's see if we can get in a few more. Next question for Elyse. And it starts with a nice thought. Hope you are safe and well. Okay, and I had an interview scheduled on April, and it was canceled due to the pandemic. Are these administrative positions going to be reopened?
I'm going to pass this question over to Rosemary because she probably has a little bit more information on it than I do.
Oh, thanks. So right now, we're in the throes of what we're calling norming, and we're evaluating which positions need to be filled immediately, which positions we don't need to fill, or which positions need to be expanded. So I'm really sorry that you didn't get interviewed when you thought you would. If you send me an email, I can, with your name, I can follow up and see where your application is. As I said, we do require your patience right now because now we're trying to really focus on the staff that we need to take care of these patients long term. During the height of the COVID, we didn't have the opportunity to interview people, so we have a lot of agency people here, and their contracts are ending. So right now we're hiring staff perm to replace them.
Yeah, and as Rosemary said, if this individual, yeah, and if this individual sends an email, we'll definitely follow up with them.
Great. Okay. Next question. We'll start with Elyse. I just graduated with a BS in psychology, and I had my associates in early childhood education. What position would you advise me to apply for?
So we have positions within our child life department that have specific backgrounds that they look for, but there are other positions that would be available. We also have positions if you're looking and interested in psychology or psychiatry in our Westchester department. We have pediatric departments also in our Westchester department that can really use people, in a Westchester campus, that could really use individuals that have experience with working with children or a background in working with children. We also have programs, and I don't know how they're being run right now, there used to be on-site schools for psychiatric patients that were either inpatient and then went to outpatient, but still needed to come back, and they were of school age. So we wanted to make sure that they still had maintained their education. So I would look in areas like that. We have one of the largest psychiatric departments in the country. And so there are definitely positions in pediatrics, if that's something that you're interested in staying in early childhood education.
Okay, great questions, great answers. We've got a few more, and this is for Rosemary. How do you leverage project management roles, especially outside of strictly IT and finance, as they pertain to operations and leadership?
Okay, so that's that's a great question and a great job for a newly minted MBA or a business degree person, but mostly the MBAs. We have almost in every single department one or more project managers that work on different things for usually somebody at a vice presidential level. So it's a great way to get introduced to an organization. In school, they prepare you to do that kind of stuff. And so sometimes these projects lead to other jobs, and lots of times they lead to other jobs. And I always advise people who have just gotten out of B school with an MBA to really look at those positions and take them seriously, because they pay well, and they really lead to many, many more opportunities. I don't know if that really answered the question, but we do leverage them. That's sort of our career pathway for hospital administrators.
Yeah, there's
All
also
right.
a quality department as well. And in the quality department, the project managers that work in that department, or the quality managers, they work across all campuses. So the exposure that they'll have to the leadership team is pretty big. So I would look within, as Rosemary had mentioned, the specific campuses, the project management positions that are in specific departments, and also the quality department.
All right, we're almost
Right.
at the end of the lightning round. Two more questions. This viewer asks, they are currently a research technician and interested in laboratory technologist position, but does not have a New York laboratory technology license. Do you have any advice for that person? We'll start with Rosemary.
Oh, well, thank you for that. Elyse probably could answer this because she's highly invested in the laboratories. So we can hire you contingent upon licensure. You would probably have to go to the state and see. They are very stringent about the coursework. If you didn't go to school in New York State, there's one particular course that only New York State requires, but we will work with you to get the course and try to hire you. I'm going to switch to Elyse, because she really is leading the charge for laboratories right now. This is an area she lives and breathes in every day. So Elyse, how can we help this person get a job?
So I would agree, depending on what the experience is. If you are a laboratory technician, it looks like you had your background in research. I would advise looking at the laboratory assistant positions that put you in the lab working with the laboratory technologists and laboratory technicians, and then finding the right program to give you, if what you need is that extra semester, what program can get that for you, what would best work with your schedule, and then the timeline to be able to take the state exam. And our clinical departments, our laboratory departments, are very well versed on all the programs throughout the area, so they can, and we work with a lot of them. We take interns from a lot of the programs, so they can certainly help you with finding the right the right program and also what the process would be and the appropriate process and exactly what you would need for that license.
All right, final question. I am a certified FNP. Do you have a position available? Do you provide H-1 working visa scholarships? And either of you, whoever wants to answer this one.
All right, so this is my area of expertise. Unfortunately, right now, we don't meet the requirements of the INS to provide H-1 visas. They're very stringent, and we do hire lots of FNPs in our clinics, on our inpatient areas, but we have too many applicants and for our positions and too few vacancies to apply to get to be able to issue an H-1B visa, or meet the requirements of the INS. So unfortunately, right now, we can't. The best place that I know of to be an FNP and get sponsored is by a nursing home. And there are some really excellent nursing homes around that provide, unlike what the press would have you believe, really excellent care. And unfortunately, that's the only way I know that you can go right now to be able to be authorized to work. And before, when we talked about how long it takes to get a job, part of the onboarding process is this I-9, where you have to demonstrate your ability or your legal status to work. And so it's not a happy ending, and I'm sure you wanted a different answer from me, but that's the best answer I can give you.
Well, we are unfortunately at the end, but I think it is a happy ending for this chat. Elyse and Rosemary, you have been wonderful. You have provided us lots of very valuable information, and I want to thank you very much. And also, for those viewing, if you want to find out about upcoming events and to look at our last career chat, please go to Facebook and to LinkedIn and like the Westchester County Association. And I would also like to thank our viewers for participating in today's event, and to thank all of our platinum sponsors. And thank you again, and goodbye all.
Thank you.
Thank you so much.